Ghana's National Cardiothoracic Center (NCTC) is currently appealing for increased infrastructure, personnel and funding to meet the country's growing cardiac care needs. Despite being the nation's premier facility for heart and chest surgery, the center continues to operate under severe resource constraints. In 2024, the NCTC recorded 437 admissions in its ICU and HDU, both with only 4 beds each. The rising demand for its services has placed pressure on limited resources, with the center performing only 146 out of an estimated 8,000 required congenital heart surgeries. At a national seminar on pediatric and congenital cardiac care, NCTC Director Dr. Ko Ensumensah highlighted the center's achievements, including 19 pediatric and 104 adult cardiac catheterizations this year. He, however, stressed the shortage of specialized staff, saying the center currently has only 5 trained cardiac surgeons for both adult and pediatric cases.
If a mother delivers a baby in a faraway corner of the country with congenital heart disease, how should it be diagnosed? Who will she go to? If a problem is detected with the child, how is it escalated? Which regional hospital or district hospital or regional hospital? If the child needs surgery, the child has to come to the Kolebu teaching hospital. What services and facilities are there? Will there be money to be able to take care of the surgery? These are complex things. As the numbers are also increasing, how do we train more doctors? How do we train more intensive care nurses and all the cadre of health workers that we need to train them? And then ultimately, how do we fund the equipment that we need? Heart surgery is very expensive, and therefore we need to get all the equipment, the technology, to offer the best service to Ghanaians. And then lastly, it is time, after 36 years, that Ghana thinks of building a bigger cardiothoracic center for the entire nation. It is the only one we have, and we owe it as a duty to the entire population to build a bigger one that can serve its purposes.
Speaking on behalf of the Health Minister, Mr. Frank Raji reaffirmed government's commitment to equitable care and long-term pediatric health strategies.
As we deliberate today, I wish to urge all stakeholders to reflect on 3 key areas. And these are: 1, access. That is, how do we ensure that no child is denied care because of where they live or their family income? And then capacity. How can we train and retain the needed workforce to provide these specialized services? Sustainability. What policy, financing, and operational frameworks are required to institutionalize these services? So in closing, this seminar is not the end, but is the beginning of a good thing to happen. A beginning of strategic coordination, clearer policy discussion, and deeper collective responsibility for the lives of all our children. To this end, let me commend to working together to research, to save hearts, and build futures.